Hello, I'm Dr. Sameera. I'm a consultant general and laparoscopic surgeon at V9 Hospital, Begumpet. So today, in patient awareness series, I'm going to discuss about the efficacy and the limitations of the latest advances that have happened in hemorrhoid surgery, that is laser hemorrhoidectomy and laser sphincterotomy surgeries. So, are these surgeries really so much better than the traditional open methods? And can the patient expect a completely pain-free post-operative period? And what are the limitations of these new surgeries? So, laser is one form of energy that will have a very focused and hairline kind of incision that we can give, and that will cause minimal pain and minimal post-operative swelling around the surgical site, and it will also not disturb the surrounding normal tissue too much. But at the same time, it is also a surgery at the end of the day, and a lot of patients are in misconception that laser surgery is completely pain free, and that any kind of pain that they experience in the post operative period after surgery, they are fearing that the surgery has failed or the surgery was not done properly. So we keep seeing a lot of patients like these. So I just want to clear that misconception that especially when the patient has external piles, that is the hemorrhoids that are covered with skin, then if we remove them with laser or any other modality of treatment, the patient is going to have minimal pain. When in comparison to the open surgery, the laser surgery is going to have minimal pain, but at the same time it is not completely painless. So the patient has to follow certain instructions that we give while discharging the patient, because a lot of patients are very inconsistent with the post-operative follow-up, and that is also one of the reasons why a lot of patients take a long time to recover from surgery. So laser definitely has several advantages, but it also has its own limitations. It is not always possible to use exclusively laser to treat a patient, especially if the grade of the hemorrhoids is higher. So what we do is a combination of technique called hemorrhoidopexy and laser hemorrhoids ablation. So there will be some amount of internal pain, especially when the size of the hemorrhoids is bigger or if the patient has been suffering for a longer period of time. So, yes, the patient can expect minimal pain after surgery, which is much lesser than the pain that patients experience with open method or traditional method. But at the same time, it's also important for the patient to follow all the instructions given by doctor and not take anything for granted, because this surgery, be it open method or laser, does have certain amount of recurrence chance, which is about 5 to 8% is what we give the patient. If the patient does not follow the instructions or does not change one's lifestyle, he is going to have a stormy post-operative period and also a chance of recurrence. So it's important that the patient factor is also taken care of. So the patient also has to put in some effort to heal from the surgery, which is very important. Thank you.